Hello, this is Dr. Do again. This video is on alphabetic list problems on letter M. Today I'm going to talk about melanoma, which is quite common either for the light skinned people or people with dark skin like myself. Previous video I mentioned about the malignancy versus benign tumor or growth, because the malignancy really refers to those kind of overgrowth of the particular cell type which lost the normal function, lost the normal morphology. So that's the and overgrowth. Depends on the location, can cause very serious problems. So that's the malignancy. A melanoma is one of the malignant tumor. Could be flat though, could be raised on the skin. Also, melanoma can be found, in addition to skin, can be found inside of the eye. So anywhere with the pigmented cells can also have this melanoma. First of all, let me bring up this melanoma, any emergency situation associated with this melanoma. Because usually when we talk about the melanoma, it's really the skin or the eye, for example. It's a chronic process unless undiagnosed suddenly grow. For example, if it is in the eye, suddenly grow to the big enough to impair the vision, and then that's the usually you probably will see physician unless the blood vessel is involved, cause hemorrhage. The same idea, melanoma tend to metastasize to the organs. So if to the liver, for example, you can have probably the subtle symptoms, nausea, vomiting, losing weight. Also, usually it's not an emergency situation, I have to say it. However, if they're always individualized, always special situation, if the tumor metastasis to the blood vessel, near blood vessel, cause invasion, cause bleeding either from digestive system, vomit up, or diarrhea, or to the kidney or whatever the emergency signs associated with the blood vessel bleeding, that's the emergency situation. Otherwise, melanoma pretty much not emergency, even though it's in the eye. Usually cause the impaired vision in you're progressively getting worse. So you need to see your either primary care, your eye doctor, or emergency to get it diagnosed. Melanoma is a cancer, so there's no way you can manage at home. So I'm not going to talk about that. So talk about the melanoma. What are the melanoma? It's the overgrowth of the pigmented cells. Those pigmented cells, usually we have it in the skin, one layer of the skin, the pigmented cells, and also in the back of the eyes. And those pigments really serve to protect the underneath tissue from the UV light, for example. The radiation of the UV light from penetrating the side of the body. So that is serving as a protection. And the pigment, mainly because the pigment inside of the cells, like a shade, nature built shade to protect the eyes, the back of the eyes, like the film, and also the skin. So then the melanoma is usually it occurred in the eye exposed area, and there's some genetic causes. Even it's not exposed to the sun exposure, still can have the melanoma. I mean, usually melanoma occur with the sun exposure area, either skin, or sometimes if the genetics risk factors with mutations can occur in some other areas associated with internal organ cancer. So that's the exceptions. But when we talk about melanoma, probably majority of the case we refer to the skin. Start from a mole, and this mole overgrow with time will change from the benign nevule to the malignant melanoma. So what are the signs? You probably know it. ABCDE. I think it's quite ubiquitous. Everybody knows about this ABCDE about melanoma. What are those? A refers to whether you used to have a mole, very rounded, flat and small, and suddenly change the A is from symmetrical to asymmetrical, become the irregular shaped. So that's A referred to. And B means the border is not like it used to be round or whatever, it's kind of smooth, but now it's not smooth, it's up and it's irregular. So that's about the border. C refers to the color change, darker, compared to you probably previously have the brown mole there, but it suddenly becomes really dark, like a charcoal. So that's the C. And D really refers to the physician after the biopsy, the depth. So those ABCDE, not only for physician to diagnose, to evaluate the extension of this melanoma, also for you as a patient to know that. And the E is kind of evolution, whether there's some other symptoms associated with this, like the hair, whether there's hair grow on it, or whether associated with other symptoms, itchy or not itchy, bleeding or not bleeding. So this is, I put it here just to remind you, if you somewhere, we all have those mole somewhere in the body, just monitor regularly. If you find to change the color, getting darker, change the shape, not regular, or used to be flat and now it's become raised, or there's some hair grow on it, and or itching or bleeding. So any of those signs, if you have it, you just call your physician. It's one is early stage, it's not a big deal, just take it out with a certain normal skin area, edging, probably ½ centimeter, make sure it's get thorough radical removed, and then send to pathology to diagnose whether it's benign or malignant. So the point is, if you have this kind of monitor closely once in a while to check it, make sure it is not changing color, not changing regularity, or anything unusual happened, then you just call your physician and to schedule biopsy and send to pathology. If it's benign, then it's comforting. If it's a malignant melanoma, then treat it accordingly, surgical remove and monitor to scan the internal organ to check whether there's some any metastasis to the internal organ. So this is about the general education for the melanoma. The risk factors, in addition to the sun exposure, like I said, the genetics, there's some people tend to have this family running melanoma from the mutation, mutated genes. But usually when we talk about the skin melanoma, it's really associated with the UV light exposure. So that's probably another recommendation if in the summer, especially in those tropical area where a hat, use the screen to protect, or umbrella. Make sure, particularly for those light skinned people, to protect from the overexposure of the UV light, so then prevent the melanoma. So this is about the general idea about melanoma. I think it's quite common. Everybody know, probably you already know it, but just to remind you, because the summer just over. I wish I did it before the summer, but next summer, hopefully you can remember this video and protect yourself. Thank you for watching. I will see you next time.